Hello. So I hope I'm audible.
Yes, ma'am. Yes, ma'am.
So good evening and warm welcome to all to the 15th episode of Okio Healthscapes monthly video magazine of DigiConnect series of Environmental and Occupational Health Initiative by IAOH Delhi branch. This series was started in December 2020 to provide monthly update on local, regional, and global environmental and occupational health issues. Session is open to all stakeholders. Dr. Gajendra Kumar, President, and Dr. Sandeep Sharma, Secretary, with Dr. Rajiv Kumar Jain, sir, Vice President of AEOH, that is IAOH Delhi branch, are the founders and backbone of this educative knowledge sharing platform. The team trio is making sure the sessions are going strong without a single miss for more than a year now. So, dear participants, let's start the session with 2 minutes investment in health with Health Moment. Hope all of you are comfortably, ergonomically seated, relaxed. Quickly, we all will try to stretch our arms. Feel like a bird. Feel like a bird. Be a bird with wings now. Okay. Move your arms slowly upwards and downwards, upwards and downwards, upwards and downwards. I'm sure you're feeling like a bird. Yeah. Okay. And now forward and backward, forward, backward, forward, backward. Stretch your neck slowly upwards and downwards, upwards and downwards. Yeah. Upwards and downwards. Do you notice any difference? Are you feeling relaxed? Great. So keep your left palm on the head. Start moving it anti-clockwise and bring your right palm in front of your abdomen and start moving it clockwise. Yeah. How is it? So this is basically to understand the coordination of mind and body. Yeah. So mind will be focused and it obeys the command. Please remember to invest in health. That is, invest your time for your health, if not doing it already. One last activity, sorry. Request all of you to close your eyes, concentrate on breathing. Please close your eyes, concentrate on breathing. Inhale slowly and deeply through your nose. Keep your shoulders relaxed. Exhale slowly through your mouth. As you blow out air, purse your lips slightly. Keep your jaw relaxed. Breathe slowly in and out. Notice what are those three sounds or noise you can hear now. Three sounds or noise you can hear now. Probably a fan or a moving vehicle nearby, or horn, or if you're lucky enough, probably birds are chirping. Now concentrate on any two things that you can feel. Probably the soft cushion of the chair, wherever you're sitting, most probably you're sitting on sofa, or the breeze, the air coming from fan touching your face. Can you feel it? Yeah, good. Now try to remember the taste of your evening tea or coffee you just had. Can you remember the taste of the tea or coffee? Isn't it refreshing? Okay. Now mind is fresh, away from all bothering thoughts, far away from the stress. Now you are ready with a new blank sheet in the mind book. You are already feeling very peaceful, ready to focus on learning. Open your eyes and now let's get started. Okay, dear all, please note this session is being recorded and shared on YouTube soon after the session. Please do visit Enoch DigiConnect webinar series on YouTube soon after the session. Subscribe, click like and notification icon. Also, please share further with your professional friends group, health team, or in your company for their benefit of knowledge. There are already 139 recorded sessions available, and this will be the 140th recorded session. And please be noted, there will be DigiConnect webinar series, a weekly video magazine at 6:30 p.m. every Saturday, that is tomorrow. Apart from COVID updates from Dr. Rajiv Kumar Jain, Dr. Vikas Alabat, Senior Consultant, Cardiac, Thoracic and Vascular Surgery from National Heart Institute, New Delhi, will speak on what physicians should know about heart valve replacements. So don't forget to join tomorrow's DigiConnect series as well. Coming back to today's session, very interesting, diversified topics will be covered today, like WHO ILO guide for the development and implementation of occupational health and safety programs for health workers. Another topic is reducing occupational sitting while working from home. One more topic is, are Japanese actually taking leaves of absence? And another important topic is 60 years of industrial health, the journal NIOSH, to mention really few. There are many, many more to this. So we welcome your questions for this session. Request you to put it up in the chat box to be addressed by Dr. Rajiv Kumar Jain soon after his presentation during question and answer time. Now coming to the tough part of my role as moderator is introducing the speaker of the session, Dr. Rajiv Kumar Jain. He is very well-known personality, a celebrity in our fraternity. Dr. Jain is currently working as Senior Consultant for Health in Indian Railways. He was Director for Health and Family Welfare in Ministry of Railways. He is based out of New Delhi. He has extensive work experience of more than 40 years. He has more than 150 scientific papers been published and presented in national, international journals and conferences to his credit. He is a valuable member and contributing to many government advisory committee, NGOs, reputed national, international professional bodies, and public health foundations, institutions. He has been awarded with many reputed fellowships, orations at the conferences of well-known, reputed national, international professional bodies. Here is Dr. Rajiv Kumar Jain, a global personality, and he is unusual. He speaks Hindi, English, and also Chinese. So I welcome Dr. Jain as speaker and soul of the session. Over to you, sir.
Thank you, Dr. Vidyakaran, for the nice word that's spoken. I don't know how much I deserve what you said, but all the same, let's get on to the OcuHealthscapes. OcuHealthscapes mean landscape of occupational and environmental health during the past 1 month. And let's see the sweep of the OcuHealthscape this episode. What is in store? As you've given a glimpse of the issues that we are going to tackle or disseminate or share with the audience today. Let's examine the most important event of past 1 month. Next slide, please. This is important. On 2nd February 2021, for the first time, ILO and WHO came together and what did they disseminate as a joint document? Two United Nations organizations with 194 countries and members, they issued an interim guidance for COVID-19, occupational health and safety for health workers. And what were the key points? Health workers should continue to enjoy their right to decent, healthy, and safe working conditions in the context of COVID-19. Primary prevention of COVID-19 among health workers should be based on risk assessment and introduction of appropriate measures. Other occupational risks amplified by the COVID-19 pandemic, including violence, harassment, stigma, discrimination, heavy workload, and prolonged use of personal protective equipment should be addressed. Occupational health services, mental health and psychological support, adequate sanitation, hygiene, and rest facilities should be provided to all health workers. Healthcare facilities should have occupational health programs in conjunction with programs for infection prevention and control. Employers have the overall responsibility to ensure that all necessary preventive and protective measures are taken to minimize occupational risk to health workers. Health workers are responsible for following established rules for the protection of their health and safety at work. And this is 1 year down the line. It was 1 year back that ILO, WHO jointly issued this interim guidance. Please remember, this was an interim guidance. Next slide, please. On 26 May 2021, World Health Assembly was held in Geneva. It was the 74th World Health Assembly. During the World Health Assembly, a resolution was proposed by Australia, Chile, Indonesia, Jamaica, Japan, Libya, Montenegro, Morocco, Philippines, Sudan, Thailand, Turkey, and member states of the African Group, and member states of the European Union and United States of America. Just imagine the group of nations which proposed this resolution. And this was agenda item number 15 on 26 May 2021. And the title of this agenda item was Protecting, Safeguarding, and Investing in the Health and Care Workforce. Let's examine what was the resolution all about. Next slide, please. The 74th World Assembly, having considered the Director General's report on the Working for the Health 5-year Action Plan for Health, Employment, and Inclusive Economic Growth, that is 2017-2021, deeply concerned about the detrimental impact that coronavirus disease has had across the health and social care sectors, expressing highest appreciation of and support for the dedication, efforts, and sacrifices above and beyond the call of duty of health professionals, health workers, and other relevant frontline workers in responding to the COVID-19 pandemic. Recalling decision of the World Health Assembly, or that is the 73rd World Assembly held in 2020, to designate 2021 as the International Year of Health and Care Workers. And guided by the 2030 Agenda for Sustainable Development, including its strong multi-sectoral dimension to achieve universal health coverage, and its call to in Sustainable Development Goals 3, Target 3C, to substantially increase health financing and the recruitment, development, training, and retention of the health workforce in developing countries, especially in least developed countries and small island developing states. Next slide, please. Recognizing the need for political commitment, policies, and international cooperation, including strong sustainable development goal partnerships at national, regional, and global levels to tackle health inequities and inequalities within and among countries in line with non-discriminatory laws and including within the health and care workforce, and how health workforce constraints impact equity of service delivery. And also recognizing the 25th anniversary of the Beijing Declaration and Platform for Action marked by the generation Equality Forum and the Gender Equal Health and Care Workforce. It called on member states, in accordance with the national context and priorities, to continue implementation of the global strategy on human resources for health workforce 2030, including through the Global Health Workforce Network, including 1, to advance the health and care workforce investment agenda with a special focus on the primary healthcare workforce in order to accelerate universal health coverage. Second, to accelerate measurement, monitoring, and reporting at an appropriate frequency to support national workforce planning based on disaggregated demographic data, including sex and other characteristics on the health and care workforce, through further implementation of national health workforce accounts to ensure sufficient number, distribution, competency, utilization, employment, safeguarding, and protection of health and care workers, including its capacity and readiness to provide strong, integrated public health functions to strengthen preparedness, prevention, detection, and response to health emergencies and support the implementation of the International Health Regulations 2005. Next slide, please. Third, to carry out an assessment of health and care workforce, implications and requirements in all health policies, strategies, plans, and programs to ensure sustained support and investment, optimal utilization of available workers across public and private sectors, coordinated leadership, enhanced workforce performance, and a safe workplace and practice environment. Please mark this phrase, a safe workplace and practice environment. Fourth, to continue to implement the WHO Global Code of Practice on the international recruitment of health personnel and the recommendation of the WHO Expert Advisory Group on the relevance and effectiveness of the WHO Global Code of Practice on the international recruitment of health personnel in 2020. To equitably strengthen health systems worldwide, to mitigate the negative effects of health personnel migration, and to safeguard the rights of all health personnel, with particular attention to the 47 countries identified on the WHO Health Workforce Support and Safeguards list of 2020, and to report triennially to the Health Assembly through the Executive Board on the global. Next slide, please. Next slide, please. On the global codes implementation, including data on international health workforce migration, such as the level and country of the professional examination data from health personnel information systems, and measures taken, results achieved, and difficulties encountered in implementing the global code. And fifth, to facilitate national and subnational capacity for an effective intersectoral coordination mechanism to manage health and care workforce agenda. Second, to engage relevant sectors and promote intersectoral mechanisms at the subnational, national, and regional levels as appropriate for efficient investment in and effective implementation of health workforce policies using a gender-based and inclusive approach. And third, to prioritize investments and the efficient and effective use of sustained domestic and international financing for the recruitment and retention, education and training, skills, jobs, safeguarding and protection needed to build resilient health system capacities, competencies, and capabilities through a health and care workforce that is equitably distributed, deployed, utilized, retained, empowered, protected, and supported to deliver national priorities and targets for population health, to contribute to better understanding and managing of health worker migration through improved data and information for the achievement of universal health coverage and for the effective implementation of essential public health functions. Next slide, please. And this is the most important part. To develop, finance, implement, monitor, specifying its method, national health and care workforce strategies and investment plans in line with population health needs now and in the future, and job, skills, and education and training opportunities with special attention to equity, gender, diversity, and inclusion in the health and care sector. Fifth, to enrich the career paths open to health and care workers in all countries by encouraging the development of both laboratory capabilities for diagnosis and surveillance and research programs that combine local knowledge with up-to-date scientific understanding and methodology. And number 6, most important, to take the necessary steps to safeguard and protect health and care workers at all levels through the equitable distribution of personal protective equipment, therapeutics, vaccines, and other health services, effective infection prevention and control, and please mark here, occupational safety and health measures within a safe and enabling work environment that is free from racial and all other forms of discrimination. I think this is the ground on which the 194 countries resolved that WHO has to work with effect from 74th World Assembly in May 2021. Next slide, please. Now, on 21st February 2022, WHO and ILO unveiled the new guide for safeguarding the occupational safety and protect the health workers from the occupational risks that they encounter. Next slide, please. Even before the COVID-19 pandemic, the health sector was among the most hazardous sectors to work in. Dr. Maria Neira, Director, Department of Environment, Climate Change and Health in the WHO, had said earlier, only a few healthcare facilities had programs in place for managing health and safety at work. Health workers suffered from infections, musculoskeletal disorders and injuries, workplace violence and harassment, burnout and allergies from the poor working environment. Next slide, please. COVID-19 has exposed the cost of this systemic lack of safeguards for the health, safety, and well-being of health workers in the first 18 months of the pandemic. About 115,500 health workers died from COVID-19. James Campbell, Director, WHO Health Workforce Department, said, sickness, absence, and exhaustion exacerbated pre-existing shortages of health workers and undermined the capacities of health systems to respond to the increased demand for care and prevention during the crisis. He added, this guide provides recommendations on how to learn from this experience and better protect our health workers. WHO and ILO recommend developing and implementing sustainable programs for managing occupational health and safety for health workers at national, subnational, and health facility levels. Such programs should cover all occupational hazards, infectious, ergonomic, physical, chemical, and psychosocial. The guide also outlines the roles that governments, employers, workers, and occupational health services should play in promoting and protecting the health, safety, and well-being of health workers. It emphasizes that continuous investment, training, monitoring, and collaboration are essential for sustaining progress in implementing the programs. Effective mechanisms should be put in place to ensure continuous collaboration between employers, managers, and health workers, with the aim of protecting health and safety at work. Alette Van Leur, Director, ILO Sectoral Policies Department, said, health workers, like all other workers, should enjoy their right to decent work, safe and healthy working environments, and social protection for healthcare, sickness, absence, and occupational diseases and injuries. Countries that have developed and are actively implementing occupational health and safety programs for health workers have experienced reductions in work-related injuries and diseases and sickness absence, as well as improvements in the work environment, work productivity, and retention of health workers. Next slide, please. Such programs are a core element for the effective management of occupational safety and health, as informed by ILO Convention number 187, and provide an opportunity for coordinated action by all stakeholders through social dialogue towards common objectives for promoting decent work in the health sector and increasing the resilience of health institutions. Vera Paque-Perdiego, Director, ILO Governance and Tripartism Department, said, WHO and ILO will continue to provide guidance and assistance to countries to develop and implement occupational health and safety programs for health workers. As I said earlier, the 74th Health Assembly resolution on protecting, safeguarding, and investing in the health and care workforce requests the Director General to engage member states and all relevant stakeholders in the development of a global health and care worker compact, consisting of a succinct compilation based on existing documents of relevant international organizations. The compact, which will be discussed at the World Health Assembly in May 2022, will include the applicable instruments on occupational health and safety. So this is the ground on which these guidelines have been issued. From May 21 to May 22. Next slide, please. This is in February that a document, which is a guide for the development and implementation of occupational health and safety programs for the health workers with the title, Caring for Those Who Care, has been issued by ILO and WHO jointly on 21st of February 2022. Before we discuss further on this subject, I would like to bring in Dr. Shubhendu Mudgal, who was engaged as a consultant in occupational health by the World Health Organization for drafting this report, and who was engaged with Dr. Ivan Ivanov intimately in preparing the draft of this report. Dr. Shubhendu Mudgal, I would like you to share your experience and the challenges you faced in drafting this report. Dr. Shubhendu Mudgal, please.
Namaskar. Thank you, Rajiv, and thanks IOH Delhi for inviting me for this talk. It's always a pleasure to be among you. I'll just share with you my experience and as a consultant occupational health and emergencies in Geneva when I was there, and how this document came about. I'll just talk in brief. See, ILO and WHO collaboration in health sector started right from the time with the development of guidelines on the protection of the health worker from HIV/AIDS in the early 2000s. And that led to closer collaboration and into a certain framework for developing the national occupational health and safety programs for the health worker. So this was thought about in around, I would say, 2009 to 2011. There was some sort of thinking on some sort of a framework so that the national programs can be developed on occupational health and safety. And this I have shared in the chat box, the framework which came out. And it contained only the 13 points. In fact, initially around, I think 2009, there were 11 points. The points on the research, point number 12, and the point number 13 was on the environmental aspects in the health sector. These were added later on by Dr. Maria, who was very keen in introducing the environmental aspects also into the framework. So these were added, and ultimately it became a 13-point document. And this document was there, but there was no further action on this part. So there was no further support to further work on this from the countries also, and there was no further looking into this document further. So once I completed my major assignment of occupational health and safety manual in emergencies, Ivan told me to work on this document also. I took the challenge. This was only 13 points, one-page document, if you see. That was the thing that was given to me total, and there was something 15-20 pages by some intern who worked on it for some time in ILO, but we had to edit it, and it was only these 13 points from where I worked and developed the complete draft of the guidelines over there over a period of 1.5 years when I worked with Dr. Ivan. So, and during this time, we also gained the field experience from the countries, mainly the from our experience of working and training the high risk countries in Africa. 17 high risk countries in Africa were trained as part of an inter-country workshop in 2016 June in Johannesburg, where I participated as a facilitator. It was a joint ILO and WHO collaboration, mainly focused on the health sector, but also involving other sectors in the emergencies response. So we trained them using the HealthWise as a tool. HealthWise also was developed meanwhile as a tool, and we further improved on that tool, and we use the HealthWise as a tool for further training on the ground to these countries. And later on, I also participated as a facilitator for the training in Tanzania and Zanzibar. Conducted 3 trainings in different regions of Tanzania and Zanzibar for the Ministry of Health, strengthening capacity on the occupational health and safety. So that was the first, I would say, the field experience of WHO. And all this was, I also incorporated my direct field experience in Ebola management when I was a coordinator by WHO in Liberia during the Ebola crisis in 2015, July to February 2016. And then I was called to Geneva for developing these guidance documents. So we incorporated our field experiences. Like, for example, I would say, if you see the manual, there might be some photograph where I was stranded in a remote area with there were no roads, and we were standing on something which was called highway. And it took us around 12 hours to travel 120 kilometers on that path. And along in between, there were certain militia also, and we had to take permission from them. Being part of WHO, they allowed us to move into the forests and all. Otherwise, it was dangerous. So these were the practical constraints and things which happened on the ground. So we incorporated all these into the travel safety and other features in the manual also, and even in the guidance also. So like that, we incorporated as much as possible from the field experience and brought it into the guide. And I'm so happy that after this 4 or 5 years of my leaving the first draft, it was in between further experience was added from different countries. We gathered mainly from the Africa and Southeast Asia and other countries, but later on also some countries, they joined into it, and now it has become a very rich document, and I'm sure that it would be of good help to all who go through it and who implement it in their regular work. So this is all I would like to share with you.
Dr. Subhendu, very deep insight into how, I would say history is written where you could not foresee, I would say, the future development of the document that you started preparing. Pandemic actually ensured that this is taken it forward, not only by few countries, but the world at large. If you see the entire European Union, United States of America, and all the African countries together, beside the other countries which moved the resolution in the World Health Assembly in May 2021, that shows the strength of the background that was the hard effort that was put in by the team that was working in WHO as well as in ILO. Now, during the past 1 year, what has happened is that a fast track mechanism has been put in place, as a result of which in February 2022, you have this strong document on occupational safety and health of healthcare workers. I would like you to deliberate a little bit more on the road ahead. How do you see this document will translate into national health programs for occupational safety and health of healthcare workforce. How do you see it going forward? Because now you have the global support. Maybe in May 2022, there is a mechanism put in place for technical and financial support for developing the national programs.
Yes, if I may speak, then see, actually now we know that because of our activities like human anthropogenic activities, all these things are happening, and these will continue. So there is a very strong movement of One Health concept.
Yes, yes,
I'm working with the World Bank on India COVID-19 project,
yes,
capacity development of the health sector in on the COVID-19, as well as now on the Prime Minister's Yojana also for the
yes,
next few years. So I
right,
think we have to incorporate the elements of the One Health into the protection of the workers also, and in the management of the pandemics also. So it becomes a much more wider area where there has a lot more collaboration, and also the risks in the other sectors, like in the slaughterhouses and like in the waste from the slaughterhouses, how it is to be managed, how the animals, live animals and others have to be treated, transported, etc. The veterinary public health is also becoming very important. So I think we need to incorporate that. We can improve this document, not only this, but also our approaches by incorporating the One Health approach, which is being now promoted very fast way by the WHO and FAO and this veterinary consortium of the OIE.
OIE.
OIE, yeah,
So
that's it.
in effect, what you're saying, that the real benefit of the pandemic and these guidelines and the national program base now being set, there shall be a sustainable program of action with national programs with sufficient financing available for long-term transformation of occupational safety and health of healthcare workforce, which will bring a transformative change globally. Would you see that as a distinct possibility now?
Yes, definitely. If I remember, I think there was a action plan by the WHO in the assembly. There was some action plan from 2017 to 2023
Yes.
for the improvement of the occupational health and safety, but not much of the work was there between 2017 and 2019. But this, fortunately or unfortunately, COVID-19 has acted as a catalyst in further stimulating
Yes.
the countries and the policy makers to look into this. I remember that when
Great.
in last year, in 2021, from April to June, I worked with Ivan again for developing the guidance on occupational health and safety of the health workers and other sector workers from COVID-19. And that was added as a interim guidance as an annexure into 2021 April document.
Right.
We developed that for the workplaces and for the protection of the occupational health and safety. So I think it's gaining recognition and requirement also. Not only, even now the corporates, they are very much aware that how to incorporate it into this business management plans.
Great.
So
Wonderful. I
that's
must tell at this juncture the audience that Dr. Shubhendu Mudgal was my batchmate.
Yeah.
During our MBBS days in Maulana Azad Medical College. So it's a long association with Dr. Shubhendu, who is very humble and very grounded, but learned, who has insight of working at the grassroots, at the national level, at the regional level, and at the global level. And yet, very unassuming person as he was during MBBS days. And that is the greatness that you have.
No.
So getting on to the presentation, we go back to this document.
Thank you.
Yeah.
I
Great.
actually,
Please discuss. Yeah.
if I may say, I have to attend the WHO that blueprint seminar,
Oh.
so I may not be available now. It's going
Fine.
on from 5:30 to 11 o'clock.
Right. I know that.
Yesterday
Great.
also, today also. That
Yes, 24th
if
and
you
25th.
please.
In fact, I shared that with other
Yeah.
audience in the past webinar.
Yes.
It's
So,
gone up to 11:30. I know.
yes.
Today's the Saturday.
That's it.
Yeah.
So
So that's good.
uh,
But we will share as long as you can stay.
sure.
Welcome.
Please keep me
Yeah.
aware of all the things about it.
Yeah.
Dr. Vidya, thank you
Great.
also. Thank you.
Great.
Thank you, everyone.
Thank you so much.
Thank you.
Thank you for joining, sir.
Thank you.
So this document, which is 125 pages document, which is a fundamental document for all health practitioners, whether they're medical practitioners or paramedical personnel or nurses or other health workers, they must know this document. Next slide, please. I'm sharing the highlights of this document, which is, though the original document is 125 pages. You could go through this and I'll share that in the other WhatsApp groups, the source of the original 125 page document. Occupational health and safety for health workers. All health workers have one main aim: to improve people's health while contributing to the enjoyment of the right to health for all. Health workers should also enjoy the right to healthy and safe working conditions to maintain their own health. Health workers face a range of occupational risks associated with infections, unsafe patient handling, hazardous chemicals, radiation, heat and noise, psychosocial hazards, violence and harassment, injuries, inadequate water, sanitation, and hygiene. The protection of health and safety of health workers should be part of the core business of the health sector to protect and restore health without causing him harm to patients and workers. Comprehensive and gender responsive programs for managing occupational health and safety for health workers at national, subnational, and health facility levels can prevent diseases and injuries caused by work while improving the quality and safety of care, human resources for health, and environmental sustainability in the health sector. Next slide, please. What is occupational health and safety? Occupational health and safety is a multidisciplinary area of work aiming at, first, promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations. Second, prevention among workers of departure from health caused by the working conditions. Third, protection of workers in their employment from risks resulting from factors adverse to health. And fourth, placing and maintenance of workers in an occupational environment adapted to their physiological and psychological capabilities. The science and practice of occupational health and safety involves several disciplines, including occupational medicine, nursing, ergonomics, psychology, hygiene, safety, engineering, among others. Next slide. Who are the health workers? All people engaged in work actions whose primary intent is to improve health. This includes health service providers such as doctors, nurses, midwives, public health professionals, laboratory technicians, health technicians, medical and non-medical technicians, personal care workers, community health workers, healers, and traditional medicine practitioners. The term also includes health management and support workers such as cleaners, drivers, hospital administrators, district health managers, and social workers, and other occupational groups in health-related activities as defined by the International Standard Classification of Occupations, that is ISCO of 08. Next slide. What are the programs for occupational health and safety for health workers? Safe sets of planned and coordinated activities at national, subnational, and health facility levels that include governance, regulations, and standards, human resources, financing, and services aimed at three things: preventing diseases and injuries arising out of, linked with, or occurring in the course of work. Second, building healthier and safer working environment. And third, promoting health and well-being of health workers. Programs for occupational health and safety of health workers are based on the following principles. First, employers of health workers have the duty to implement occupational health and safety measures, while health workers have the right to healthy and safe working conditions. A duty to comply with the instructions for health and safety and to take reasonable care of their own safety. Second, occupational health and safety measures require a system for management, continuous improvement, and regular dialogue between employers, workers, and their representatives, as well as involvement of other stakeholders. Second, efficiency can be increased by enabling synergies between programs targeting health workers and health facilities, such as programs on the quality and safety of care, health workforce management, and environmental health. The aim should be to cover all health workers in all types of health facilities, and that programs are implemented in sustainable ways to ensure continuous protection of the health and safety of health workers at all times. And fifth, development and implementation of the programs should be gender responsive, non-discriminatory, and inclusive, taking into account the special needs of female health workers, migrant health workers, vulnerable groups, and workers with precarious employment conditions. Next slide, please. What are the key elements of the national programs? The key elements of a national program for occupational health and safety of health workers include: first, national policy statement on occupational health and safety for health workers issued at the highest possible level and communicated at all workplace levels and in all management and practice environments in the health sector. Second, a unit or person in charge of occupational health and safety of health workers designated within the Ministry of Health. Third, a multi-stakeholder steering committee for health and safety in the health sector involving employers and workers' representatives established at the national level to oversee and steer program implementation, monitoring, and evaluation. Fourth, regulations and standards for prevention and control of occupational health hazards in the health sector available in all health facilities. Fourth, a set of objectives, targets, and key indicators for monitoring and evaluation of programs implementation at the national, subnational, and facility levels available and integrated into the National Health Information System. Fifth, established mechanisms for efficient financing of measures for the health and safety of health workers. Adequate human resources for occupational health and safety for health workers in sufficient numbers and technical knowledge and skills available at all levels of health systems. Adequate supplies and commodities, including personal protective equipment, vaccines, safe medical devices, equipment, and tools for safe work readily available at all levels of the health system. Standards for the provision of occupational health services for health workers available, along with a system for quality assurance and a program for their expansion. And last but not the least, policies for the provision of support services for the health workers addressing human immunodeficiency virus, HIV, tuberculosis, and hepatitis B and C services for all health workers. Next slide, please. What are the deliverables of a facility program? The key deliverables of a program for occupational health and safety in a health facility include a written facility occupational health and safety policy available in all health facilities, focal points for occupational health and safety designated and trained in all health facilities, joint labor management committees for health and safety as required by national regulations, appointed, meet regularly with meetings documented, a regular training program and safety briefing plan for all health workers and specific target groups that is designated, planned and implemented. Action plans for work improvement that are developed, implemented, monitored, and evaluated in collaboration with safety and health committees and health workers representatives. Risk assessments, prevention, and mitigation of occupational health hazards that are regularly carried out and documented. A policy for necessary vaccination of health workers according to the national immunization policy and the specific occupational health hazards. Immunization against vaccine preventable diseases that is provided at no cost of health workers, ensuring that all required doses of immunizations have been received by all workers at risk, including cleaners and waste handlers. Standard operating procedures for reporting accidental exposures to occupational hazards and incidents while eliminating barriers to reporting and providing a blame-free environment. Arrangements for recording and notification of occupational accidents, occupational diseases, and as appropriate, dangerous occurrences, commuting accidents, and suspected cases of occupational disease. Services for early detection, diagnosis, treatment, care, notification, and support for occupational diseases and injuries. Developing and implementing occupational health and safety programs for health workers. The standard plan, prepare, develop, and implement should be followed. And for each phase, there is a specific action which is delineated. Next slide, please. These are the resources which are worth going through, caring for those who care for national program for occupational health and for health workers, caring for those who care, guide for developing and implementing occupational health and safety programs, occupational hazards in the health sector, protection of health and safety of health workers, health-wise work improvement in health services, action manual and trainer's guide of the ILO WHO, of which was given in 2014. These are 5 important documents which are useful for going through and understanding and implementing the national programs. Next slide, please. This is the key elements of national occupational health programs for health workers according to the WHO ILO Joint Global Framework, which means a responsible person that is identified, a written policy is developed, ensuring access to occupational health workers by strengthening existing and establishing new programs, create joint labor management health and safety committees, provide ongoing for periodic education and training, identify hazards and hazardous working conditions, provide pre-service and ongoing immunization against hepatitis B and other vaccine preventable diseases in the workplace at no cost, promote exposure and incident reporting, promote and ensure health worker access to diagnosis, treatment and care and support for HIV, TB, hepatitis B and C, utilizing appropriate information systems, ensuring the health workers are provided with entitlements for compensation for work-related disability, promote research on occupational health and safety issues of concern, and promote and implement greening health sector initiatives that incorporate occupational health and give green and safe jobs while reducing greenhouse gas emissions with a preference for the use of renewable energy. Next slide, please. This is the structure of the National Program for Occupational Health and Safety of Health Workers. Ministry of Health with the Principal Secretary, with the Department of Unity Officer in charge of occupational health, with the district, state, provincial health team, unit officer in charge of occupational health and safety of health workers. Then at the health facilities level with more than a specified number of employees, focal point for occupational health and safety, joint labor management committee for health and safety and occupational health service. At the same time, you have the National Steering Committee, you have the National Health Institutions, focal points and joint labor management committees, and health facilities with a specified number with having focal point for occupational health and safety. And also you have Ministry of Labor Department in charge of general occupational health and safety in an inspection as collaborator. Next slide, please. This is the management system for occupational safety and health, which has inner circle blue audit, and second level policy, organizing, planning and implementation, evaluation, and action for improvement in a continuous manner. And on the outer circle, you see the yellow circle, continual improvement, which is not having a closed circuit. It is a continuous process. Next slide, please. So with this background, we move on to another important event which happened this week. The ILO WHO step up collaboration to address health emergencies and promote healthier and safer working population. In a joint communique, WHO and ILO acknowledge the need for and commit to strengthen the cooperation between the health sector and the institutions of the world of work to address more effectively the ongoing COVID-19 pandemic, protect all workers from occupational injuries and diseases, and prepare workplaces for future public health emergencies. Next slide, please. WHO and ILO are committed to strengthening further their ongoing collaboration of public health preparedness and readiness for health emergencies, including at the workplace, and to engaging in joint action toward healthier and safer working conditions in a safe and healthy work environment for a human-centered recovery from COVID-19 pandemic. Both organizations will link their research agendas around areas of common interest, namely by expanding the estimates on the relations between health and work to inform future efforts and collaborations at the international and country levels. So this shall stimulate collaboration between public health and labor authorities and their partners in the country, which is most important. We in the occupational health field have been saying this, there needs to be increased collaboration between the Ministry of Labor and Ministry of Health, even in our country. And that too should happen at the state level, at the district level as well. Next slide, please. Now, having gone through this important event during the last 1 month, I would now take you to important publications in the journals of international repute in the area of environmental and occupational health. First is the Journal of Occupational and Environmental Medicine. In its February 2022 issue, there's an important article, Reducing Occupational Sitting While Working from Home, Individual and Combined Effects of a Height Adjustable Desk and an Online Behavioral Intervention. This study examined the individual and combined effects of a height adjustable desk and an online behavioral intervention on sedentary behavior and health among university employees working from home. There were 95 participants. They were randomly assigned to one of 4 conditions, that is desk only, program only, third desk and program, and fourth control. Desk participants received a height adjustable desk. Program participants received a 12-week web-based intervention, and outcomes measured at baseline and post-intervention included workday sitting and cardiometabolic health outcomes. Let's look at the results. Reduction in sitting were largest in the desk plus program condition, that is 206 minutes per workday, and followed by the desk only condition with 122 minutes per workday, and the program only condition 96 minutes per workday. There were no significant changes in the health outcomes assessed. So the conclusion is both a height adjustable desk and an online behavioral intervention effectively reduced occupational sitting, and a combined approach was most effective. And this is what we should be practicing. And this is what we should be recommending to our organizations. Providing height adjustable desk will not alone will bring the change. You have to have online behavioral intervention, which should be effectively implemented to bring the desired results. Let's look at another article. Next slide, please. This is an interesting article which is published in the journal Industrial Health. Industrial Health is a journal which is published by the National Institute of Occupational Safety and Health of USA, but the journal is published from Japan. And the article says And it's a letter to the editor. Are Japanese actually taking leaves of absence? This has come from a research and education faculty of the Medical Sciences Cluster and the head of the Health Service Center, Kochi University, Japan, and the Department of Psychiatry of Guma University, Japan, and the Center for Peace, Hiroshima University in Japan. Next slide, please. Compared to the rest of the world, workers in Japan are known to annually take paid leave at a rather low rate. In 2001, 49.5% of Japanese workers annually took paid leave. On average, 47.1% did so in 2006, 48.1% did so in 2011, 48.7% did so in 2016, and 51.1% did so in 2017. Japan is a world leader in overtime. In order to remain healthy while working, Japanese need to properly take leaves of absence. Since the percentage of Japanese workers who annually take paid leave showed no signs of decreasing, the government mandated that employers who have workers take paid leave as part of a reform of working patterns in April 2019. Workers who earn 10 or more days of paid leave a year must take 5 days of paid leave per year. If a company is found to be in violation, it is subjected to a fine of up to 300,000 yen. In 2019, according to a 2020 study, 56.3% of workers who annually take paid leave. This is the highest percentage thus far and is presumably due to the effects of workers being mandated to take paid leave. Really path-breaking in changing society's behavior toward the work ethic and devotion to work. The culture in Japan is changing now through a law, through a reform of working patterns, which was implemented in April 2019. And this is important for all of us to understand, to take paid leave when you are entitled. Because only then you could have possibly a good work-life balance. Let's see another article next. Next slide, please. Although workers are mandated to take paid leave, do workers actually take time off or work purportedly on leave? Average overtime has been found to exceed 100 hours a month, which is the limit on overtime, since any more overtime can lead to death from overwork. And workers have been found working on holidays. In a society like this, workers are often unable to fully relax mentally and physically. In the recent past, teleworking, next slide please. Working from home has been recommended due to the effects of COVID-19, but teleworking can blur the distinction between working hours and private time. In fact, working long hours at home may not be treated as overtime. Thus, companies and workers need to clearly distinguish between working hours and private time or rest and recreation. We have concluded that the percentage of Japanese workers who take paid leave cannot be fully ascertained by studies of workers alone. Detailed circumstances need to be ascertained. For example, did the worker not come to work while on leave? Did the worker do no work at all while at home or on vacation? And was the worker not contacted at all by his or her employer? In order to ascertain these circumstances, a study indicative of realities at the national level should be conducted in cooperation with the relevant agencies. Based on those results, workers and companies should be given appropriate advice and specific actions should be taken by the workers and companies. This is path-breaking. We should learn from what Japanese are going ahead. They are focusing on work-life balance now through a diverse range of measures, not only stipulation by law, but also doing research on the effects of the outcome of this intervention. Next slide, please. Another article is being shared. This is the cover of the January 2022 issue of the journal Industrial Health. This issue is volume 60, number 1. That means this journal has completed 60 years. This calls for celebration, this commemorative event, even in the face of variety of challenges of scientific journals have encountered in continued publication. Compared with other areas, there are less scientists and practitioners covering occupational health and safety, collecting better quality submissions and managing the review process in a timely manner and are vital tasks. However, these are sometimes difficult to complete effectively. Financial issues have affected both the editorial offices and contributors, and journals must obtain sufficient funding for publication. In recent years, authors have had to pay $2,000 to even $8,000 processing charges to publish just one paper. The age of 60 has a special meaning in Japan. Rebirth. 60th birthday of an individual is usually celebrated by wearing a red hat and a padded sleeveless vest. This sort of attire implies return to being a baby, together with best wishes for their subsequent period of life, their next 60-year cycle. In the same way, industrial health is going to be reborn to provide you with more essential evidence and information for workers, workplace, and society. We greatly appreciate the continued support from scientists, practitioners, readers, reviewers, editorial board members for the journal Industrial Health. At this juncture, I must tell all the members that this journal is available free of cost if you're an ICO member. Just go to the ICO website and go to the private area of members area, and you can access the journal free of cost. There's no subscription charges for all ICO members. Next slide, please. The year 2022 marks this journal's 60th anniversary, having launched in 1963. Most journals in the field are found to have continued publication for over 60 years as of the year 2022. Topmost, the oldest journal is International Archives of Occupational and Environmental Health, 95 years. Occupational and Environmental Medicine, second journal, 79 years. Occupational Medicine, 72 years. Annals of Work Exposure and Health, 66 years. American Journal of Industrial Medicine, 65 years. Journal of Occupational and Environmental Medicine, 64 years. And Journal of Occupational Health, 64 years. And Scandinavian Journal of Work, Environmental Health, 48 years. So this journal, Industrial Health, should be a regular read for all occupational health practitioners in India. Another article which is important for all of us to read is the February 22 article, which is 64th year of the Journal of Occupational and Environmental Medicine. The title is Impact of Railway Critical Incidents on Train Drivers and Effectiveness of Critical Incident Management and Support Protocols, a Recovery Trajectory Analysis. Results from the study stress the importance of adequately implementing all aspects of comprehensive critical incident management and support protocols to reduce the negative impact of railway critical incidents. Protocols should include management at the scene, short and long-term assessments of needs, and providing support at each stage. Next slide, please. This is the article which came from the Psychology Department, Center for Research and Intervention in Suicide, Ethical Issues, and End-of-Life Practices in Quebec, Canada. Next slide, please. The objective was having train drivers are regularly involved in railway critical incidents, and critical incident management and support protocols have been developed to support them. This study described the impact of critical incidents and evaluates the effectiveness of the critical incident management and support protocols. The method was 74 train drivers were interviewed 1 week, 1, 3, and 6 months after the critical incident. They performed linear growth model analysis to describe recovery paths and the effects of the critical incident management and support protocols, considering the effect of critical incident complexity, proximity to victims, social support, self-assessment of health, use of resources, and attribution of responsibility. The results were that critical incidents have a significant negative impact on train drivers. The recovery paths can be explained by the level of implementation of critical incident management and support protocols and other contributing factors. The conclusion is that the critical incident management and support protocols are effective in reducing the negative impact of critical incidents and should be implemented rigorously by employers. And this is the important conclusion which comes from this study. All organizations having transport as the core business should understand this method of reducing the impact of the critical incidents on the drivers. Next slide, please. Results from this study stress the importance of adequately implementing all aspects of comprehensive critical incident management and support protocols to reduce the negative impact of railway critical incidents. Protocols should include management of the scene, short and long-term assessments of needs, and providing support at each stage. Next slide. If you recollect, from 6th to 10th of February 2022, ICO, International Commission on Occupational Health, had its 33rd International Congress on Occupational Health. And this poster, this e-poster, which is by K. Gupta from IIT Monash Research Academy, Indian Institute of Technology, Powai, as well as Environmental Science and Engineering Department of Indian Institute of Technology, Powai, along with P. Jahan from IUF Leibniz Research Institute of Environmental Medicine of Dusseldorf, Germany, and also Puleria, H.C. Puleria, and who is from Interdisciplinary Program in Climate Studies, Indian Institute of Technology, Powai, Bombay. They had jointly there are 5 authors who have written this, I would say, study, and presented by Mr. P. Vijay, Prince Vijay from Mumbai. Next slide, please. In an urban environment, people may be exposed to more toxic elements via ingestion and inhalation of contaminated particles. Lead, cadmium, chromium, arsenic, nickel, and copper, extremely toxic even in small amounts, are difficult in biodegradation, exhibit persistence, toxicity, and bioaccumulation, and keratin-rich tissues like hair and nail. Simple matrices require non-invasive sampling and are easy to collect and transport. And incorporation in body tissues may help to examine long-term accumulation of trace metals. That was the rationale of this study. And toxic metals of environmental origin, metals transported into body via inhalation, ingestion, and double contact, bioaccumulation in body tissues, the respiratory disorders, impaired cognitive function, and cardiovascular disorders happen as the outcome. Next slide, please. Methodology and study area was Mumbai. Study sites in Mumbai, India. Hair and nail samples were collected from a subset of homes represented by the dots. 115 scalp and hair and toenail samples collected from adult females in the 18 to 65 age group from 3 areas: Andheri, a traffic neighborhood; Worli, a residential neighborhood; and Ghatkopar, which is a traffic cum residential neighborhood in Mumbai. Ethnographic and socio-economic parameters such as age, height, body weight were collected through a structured questionnaire. And you are seeing how the process was gone through. Next slide, please. The results were lead 18.5, chromium 24.9, and copper 27.4 dominated in both the tissues, nail and hair. Highest metal concentration observed in the subjects from the traffic dominated neighborhood. Significant differences were observed between the traffic and residential neighborhoods for chromium, cadmium, nickel, arsenic, and lead in hair samples. Significant differences between molybdenum, lead, and cobalt for the 21 to 30 and 41 to 50, 51 to 60 age groups in hair, between 21 to 30 and 61 plus age group in nail samples for cobalt. Next slide, please. Significant differences in copper concentration observed in normal, that is 18.5 to 22.9 kilogram per square meter, and overweight BMI groups. Copper higher in the latter in the nail samples. No significant differences observed in metal concentration across BMI groups in the hair samples. Strong positive correlation observed between molybdenum and lead, and a moderate correlation between B and SB. So next slide shows discussion and conclusion. Lead and chromium dominated in both hair and nails. Major sources could be food, water, and airborne particulate matter. Higher heavy metal concentration observed in the traffic dominated neighborhood, indicating the role of vehicular sources. Higher accumulation of lead, molybdenum, and cobalt observed in older age groups, which is in agreement with the previous studies examining blood lead levels among age groups. Copper and molybdenum identified as essential elements were significantly higher in the higher BMI and older age groups. However, their toxicity levels need to be studied in more detail. The best of knowledge, this is the first study that examined the hair and nail samples across wide age and BMI spectrum in Indian women across different urban locations in a metropolitan city. And these findings highlight the need to establish baseline concentration for trace metals using non-invasive biosamples in the population as a step to promote better public health. Limitation of the study were the study focuses only on the cohort of adult women 18 to 65 years in an urban cosmopolitan area. Males and women less than 18 years and more than 65 years have not been covered in the study. Moreover, the effect of artificial hair treatment and dietary contribution have not been examined. And this study, this e-poster got the best e-poster award for the student section in the International Commission on Occupational Health. And this paper came from India, from Mumbai. And also Mumbai is the venue for the ICO 2027 Global Congress on Occupational Health in 2027. Next slide, please. The World Health Day 2022, the theme for 7th April World Day 2022 has been declared. It is Our Planet, Our Health. Are we able to reimagine a world where clean air, water, and food are available to all, where economies are focused on health and well-being, where cities are livable, people have control over their health and the health of the planet? In the midst of a pandemic, a polluted planet, increasing diseases like cancer, asthma, heart disease, on World Health Day 2022, WHO will focus global attention on the urgent actions needed to keep humans and the planet healthy and foster a movement to create societies focused on well-being. WHO estimates that more than 13 million deaths around the world each year are due to avoidable environmental causes. This includes the climate crisis, which is the single biggest health threat facing humanity. The climate crisis is also a health crisis. I would like to share a video in the end to highlight the effect of health on the human body, effect of environment on the human body. And it's a short video.
Air pollution. It lurks all around us, preying on the young and old. It slips unnoticed past your defenses and assaults your lungs, heart, and brain. Its deadliest weapons are invisible, poisonous particles that can be as small as a molecule. With every breath, they break through your lungs' protective barriers. There, they trigger inflammation as your system tries desperately to fight back. But these tiny intruders penetrate those defenses, lodging toxic compounds even deeper, sowing the seeds of cancer. They slide straight into your bloodstream, sabotaging your entire body. They inflame and constrict your blood vessels, increasing blood pressure until, one day, causing a stroke. The particle prowlers dislodge fatty plaque that may have built up from your diet. They weave clots that can be deadly blockers of blood flow to your heart or brain. With each new case of heart attack, stroke, lung disease, or cancer, air pollution adds another life to its hit list. Let's stop this invisible killer.
So, Breathe Life 2030 is a movement, and that will get momentum with the World Health Day 2022 on 7th of April 2022. Let's get involved with it. Next slide, please. And in the end, I would like you to also be available for 25th to 27th March 2022 for the 9th Global Conclave of Association of Environmental and Occupational Health Delhi, OccuClave 2022 in Scope Convention Center, Lodi Road, New Delhi. The theme is fostering health, well-being, and environmental sustainability for future-ready organizations. Next slide, please. So you can register and you can contact. The details are available in this slide. Next slide, please. So we shall meet again on March 25, 2022 at 6:30 p.m., which is the last Friday of next month in March 2022. I must thank you for your attention.
Sir, thank you, sir. So it is, as always, you have exceeded the expectation in delivering the diversified deliverables for the session today. And it was wonderful and surprising to have Dr. Shubhendu Mudgal, who has developed the national OSH program guidance by WHO and ILO. And it was really great to hear him, his experience, insights, his views on way forward on One Health, health and safety for health workers. And it was really good update on interesting study on occupational sitting while work from home. Job stress is quite prevalent in Japan and is taken quite seriously by policymakers over there. And to see 60th Journal of Industrial Health by NIOSH and impact of railway critical incidents on train drivers and effectiveness of critical incident management support protocols. Thanks for sharing the abstract, which won best student presentation in ICO. It's really scary research report on how heavy metals in environment, maybe due to the heavy vehicle exhaust as diesel, are affecting us in the study done at Mumbai, and very impactful video on how environment pollution are affecting us. Sir, as the floor is open to the questions, there is one question from Dr. Damodar Lele. He is asking who is interested in health of health workers. How many health institutes have opted for quality inspection, say NABH or NABL? How many health institutes are ready for OSHA's or ISO 45,000 audit?
Well, very, very good question, Dr. Damodar. I would say if you look at the NABH standard, and this is the 5th version of NABH standards, which is in vogue in our country, it has, out of all the standards, there's one standard for occupational health and safety. So NABH standard does incorporate occupational health and safety of health workers. And all the factors which have been enumerated in the national program guidelines, they are a part of our national standard. Please remember, NABH standards in India are globally aligned. They are globally valid and they meet the international standard, though it is a national body, because there is an International Society for Quality in Healthcare and our country is part of the global movement. So they are aligned to the global standards. Second, if you look at the number, I feel the number has grown to a very large extent through a multifarious initiative by Government of India as well as Ministry of Health. At the moment, there are more than 13,000 hospitals which are empaneled under NABH certification system. And fortunately, the previous block of only having one standard, which was very high, what they have done is now stepwise manner. One could go for NABH accreditation, entry level, mid level, and the highest. You could go step by step. One could initiate the process and yet be NABH standard aligned. So I think that is the right way to go through in a developing country like India, where the journey begun on quality shall also incorporate occupational health and safety of health workers. But the point you've raised is important. Many hospital managers, many workers in very reputed hospitals are not aware that there is a program within their hospital for occupational health and safety of health workers. But if it is NABH accredited, there has to be a program that's a prerequisite for going mark of accreditation of NABH.
Okay, thank you, sir. I think we are coming to the end of the session. There are no more questions. No more. Okay, one hands up, sir. I'm sorry. Dr. Damodar Lele, do you want to ask the question, Dr. Damodar Lele? Your hands up. I think you're on mute. Dr. Damodar Lele.
Yeah, hello. Can you hear me?
Yes, we can hear you, please.
See, NABH, people just register and don't do anything further. Are you aware of it? See, suppose there are 100 hospitals who are NABH accredited, there will be thousands who have just registered and left it at that and putting the thing on the paper that they are registered for NABH. Nothing more than that. They don't complete it.
I would say this way, quality, if not initiated in a self-driven manner, is not quality. That's part one. And we should differentiate between registration and accreditation. Accreditation is driven by the organization owners and is a self-driven mechanism. Unless the management is convinced that they should go through the journey of quality accreditation, they should not start the process. Part one. Part two, and one accreditation in NABH is not permanent. All accreditation are valid for only 3 years. And during the process, there is an internal evaluation done once every year. And the third year, there is an external evaluation done for actual adherence to the quality standards. And if they are not found to meet those standards, the accreditation is withdrawn. So please understand there are a number of organizations which are where quality accreditation of NABH has been withdrawn because the organization was not meeting the standard they said they are meeting. That's part one. Part two, NABH also stipulates a responsibility on the users of that healthcare facility to inform NABH for deviation from those standards. So all the employees as well as beneficiaries of any healthcare organization which has been accredited by NABH, they can inform NABH through an email or other means that this organization, this hospital or this institution is not adhering to the accreditation standards. And then NABH does external verification and takes appropriate action of de-accrediting that organization. But one must remember it's a voluntary process. If not done in its context, I think that defeats the entire process of quality accreditation in the health sector.
I hope Dr. Lele, Dr. Jain answers your question. Satisfied?
I'm not satisfied, but let us leave it at that.
Okay. Okay.
Thank you for asking an important question.
Yeah, it is probably debatable. Yeah. So I think we are coming to the end
Yes,
of the
true.
session, and I thank Dr. Shubhendu Mudgal for being with us today. And I also take this opportunity to thank the organizers for allowing me to moderate this educative session today. I would like to congratulate and thank Dr. Gajendra Kumar, President, IAOH Delhi branch, Dr. Sandeep Sharma, Secretary, IAOH Delhi branch, and all supporting members of IAOH. Shivang Vasisht and Secretariat at IAOH Delhi branch for efficiently managing behind the screen activities. Most importantly, Dr. Rajiv Kumar Jain, so part of this webinar series for all his hard work to provide us comprehensive update on local, regional, and global environmental and occupational health news with his insights. That is very much important. Last but not the least, I thank all of you, the participants of the session, and wish you all a very happy weekend. Thank you.
Thank you so much for moderating very efficiently. Thank you so much.
Thank you, sir.